Why does sex hurt? There could be so many different reasons why sex hurts. The simplest reason is you're simply not aroused enough and there's not enough vaginal lubrication, which means more time needs to be spent helping you build your arousal. So that's one possibility. Another possibility is women and men have over 24 muscles in their pelvic floor. So pelvic floor is like a bowl or a hammock of muscles, and this bowl is involved in when you urinate, it's involved in defecation, and it's involved in sexual activity. And when those muscles are way too tight, right? So it's closing up, it's making it difficult to urinate. It's making it difficult to have a bowel movement. This is when you're going to experience constipation. This is when you're going to experience sexual pain. So if those muscles are too tight, that's not good for your bowel, your bladder, or sexual activity. If those muscles are too weak, you're going to have urinary leakage. You're going to have anal leakage. So you want those muscles kind of to be like Goldilocks, not too tight, not too weak. You want them to be healthy, just like other muscles in your body. So when these muscles are way too tight, again, like I said, that's going to cause sexual pain if you're having penetrative sexual activity. And oftentimes the telltale sign that your sexual pain is a result of really tight, tense muscles, two things. One, you attempt to have vaginal penetration with your partner and your partner's penis, phallus, dildo, whatever it might be, just cannot penetrate, just simply cannot penetrate the vagina. It's like it's hitting a wall. So that's one sign. This hitting a wall is a sign that that's probably those tense, tight pelvic floor muscles. But another sign is let's say you're able to have penetration and the pain is with deeper penetration. Oftentimes when you say, well, it's okay initially with initial penetration, but with deeper penetration, that's where I feel the pain. And maybe the pain feels kind of like a burning. What that tells me is that the penis, phallus, dildo, whatever it might be, is hitting those tense, tight muscles. Like if you can imagine those tense, tight muscles are like, you have like a knot. If you have a knot in your shoulder, it's kind of like having a knot in those muscles. And if someone's going to poke and prod at that knot on your shoulder, like it's going to burn, it's going to ache. So if you're saying deeper penetration causes maybe like a burny, achy feeling, then that suggests that it might be pelvic floor muscles that are way too tense and tight. And for that, you need treatment from not only your physician or sexual medicine provider, but a pelvic floor physical therapist. There are physical therapists who are trained to work with those couple dozen muscles on the pelvic floor and teach you to be aware of those muscles and learn to relax them and kind of get those knots out. So that's another potential cause of pain. Another cause of pain is if you say there's pain with insertional penetration, so there's pain right at insertion, that could suggest that there's something going on with the tissues of the vulva, so the vestibule, which is right around that vaginal opening. Those tissues or tissues of the vulva are really sensitive. Maybe there's a dermatological issue. There are a couple things called lichen sclerosis, lichens planus. These are dermatological issues that impact that vulvar tissue, which make it, when you're having penetration, that tissue can rip, it can tear. It's very sensitive tissue. So this could be a dermatological issue. And again, if you think there's something like that going on, you need to see a sexual medicine physician, see your OB-GYN, see a provider so they can take a look at that skin tissue. And then let's say that your muscles are healthy, dermatologist isn't seeing anything with any dermatological issues. Another issue that could be going on is what's called vulvodynia or vestibulodynia. Basically, these fancy words that end in dynia mean that there's pain. There's pain of the vulva. There's pain of that vestibule around that vaginal opening. And what that pain is what a doctor will do to assess that pain is they take a Q-tip. It's called the Q-tip test. And basically, they take this Q-tip and they put it on different areas of your vulva, just tapping, just touching the different areas of your vulva. And for women who have vulvar tissues that are really sensitive, it's almost like those vulvar tissues have a volume button, and that volume button is turned on high. So for women who have that volume button turned really high for their vulvar tissues, when that Q-tip touches their vulva, it hurts. It hurts when it's just a Q-tip. It's just a Q-tip. So again, when that happens, we call that vulvodynia, or we call that vestibulodynia, which those words aren't very descriptive because it's essentially just saying like, yeah, you have pain of the vulva. It's like going to your doctor and saying, the doctor says to you, oh, well, you have stomachodynia. Well, okay, yeah, I have pain of the stomach, but tell me what's causing it. So we don't know exactly what causes vulvodynia. There are so many different potential options, but the way you can think about it is your nerves, that volume button on your nerves are turned to high. So something as simple as a touch of a Q-tip hurts. So those are several different reasons why someone might be experiencing pain with sex. If you're experiencing any of those, reach out to a sexual medicine provider, talk to your primary care provider or your OB-GYN and see if you can get some answers, because you deserve answers. You do not deserve sexual pain.